So, hello, my name's Ariana, and I have pulsatile tinnitus. First off, I always thought it was pronounced tinnitus, and learned that it is not. It is pronounced tinnitus. Doctors will call it tinnitus, but I have a form of tinnitus called pulsatile tinnitus, which means I don't hear that like high-pitched ringing sound of typical tinnitus. I actually hear my heartbeat. So it sounds kind of like a whooshing sound in my left ear, and it kind of sounds like running water almost. Or like when you get water stuck in your ear and you like make that movement, like, do I have water in my ear? And you go like this, and then you hear that. That is what it sounds like, but constant. And it is on beat with my heartbeat because it's actually blood flow from my heart, or obviously it's blood flow that I can hear. There's some sort of communication, blood flowing, from what I gather, with my cause of my pulsatile tinnitus. There's some sort of communication that shouldn't be there. So there's blood flowing near my inner ear, near the bones in my ear that cause us to hear. There's extra blood flow, and so sounds like my heart. Almost like, for me, it almost sounds like if you're in the car, bless you, and you have the window down and you can hear the wind, like, or if you turn your head as the wind blows and you can hear that of air. That's kind of what it sounds like, but it's constant with the beat of my heart. Sometimes it's louder than other times. It started out when my daughter was born. She was born September 29th, and she had to go to the NICU and for some monitoring for a few days. And so while we were there, because it's COVID, other family wasn't allowed, only one visitor at a time. So my husband and I would trade off going to see her, and I would set up my phone. So I'd be sitting in the chair, and I would set up my phone here, and I'd be holding her, and so that whoever I was talking to could see her. And it was like on a desk. And so it started out when I would turn my head this way to the left was when I could hear it. And then if I was here, it was fine. I couldn't hear anything. Or if I turned my head all the way to the right, I could hear it. There's little Evelyn. Or if I turned my head all the way to the right, I could hear it. Seems to be loudest when I turn my head all the way to the right. It gets a little quieter when it's to the left. When it's to the left, all I hear is kind of like a beat. But to the right, it's like constant swishing. And then forward is kind of in between the two. So when I sleep on my right side, it's actually louder because I'm covering the sound from my right ear. So the external sounds are not masking it as much. So it's really loud when my right ear is covered. And so it's most comfortable to sleep on my left ear. Because even though the ear is plugged, I could still hear it because it's not coming from the external world. It's coming from inside. So I can obviously still hear the blood flow in my head. So it's always there. a lot of the times I get distracted from it. So for me, thankfully, it's not so loud that it's like debilitating. I can go about my day and tune it out, ignore it, and focus on this little one. But I'll admit, like when it first developed, so let me go back. It first started when she was in the NICU, and it was only when I turned my head all the way to the left and right. Then over the next few days, I noticed that it was when I turned my head here. I could still hear it. I turned my head here, I could still hear it. But in the middle, not so much. So it was like a certain degree, turning my head a certain degree. First it was really extreme, and then it was not so extreme. And then over time, it got to where all the time I could hear it, even facing forward. So no matter which way I face, I can hear that whooshing sound. And so I Googled it and, Googled whooshing sound, whooshing heartbeat sound. And I knew it was my heartbeat because as I would, as a new mom, so if the baby would cry, my heartbeat would go faster. My heart would beat faster, and I could hear it start to beat faster. And then when I would calm down, take deep breaths, and it would like slow down. So I'm like, okay, this is definitely my heartbeat. I felt my pulse, and I was listening. Okay, this is definitely my heartbeat. So I Googled it, whooshing or heartbeat sound in ear, and found the term pulsatile tinnitus. And I was like, well, this is what I have for sure. There's nothing else that comes close to describing this. And this is exactly what it is. I can hear my heartbeat in my ear. It's not imagined. You can feel the pulse. I had my husband feel my pulse. And I was making the whooshing sound. And he's like, yeah, that's right on with your heartbeat. I'm like, I know. So, I told my midwives, because we did a home birth, so I told my midwives about it, and did I talk to my GP? I think I mentioned it to my GP. Yeah, I did, because I thought maybe there was, before I learned exactly what the issue was, I thought maybe there's some earwax, or I have an infection or something, and so I got checked out of my GP, and they're like, there's nothing in there. It's probably because of all that extra blood that you had during pregnancy. There's probably just some like extra blood in there, and over time it will most likely dissipate. And my midwives told me the same. Well, they said, wait, like 6 weeks, allow your body to adjust, which makes sense. Like I had all that extra blood, hormones. They didn't want me, I was a new mom, so you never know, like it could be stress, like wait it out. I understand where they were coming from, but they obviously had never heard of pulsatile tinnitus. Like I told them, I said straight up, like I have pulsatile tinnitus. I can hear my heartbeat in my ear. Do you know, is this pregnancy related? Could it be related to my medications that I'm on? I'm on an antidepressant and anti-anxiety medication. Talked to my psychiatrist to see if maybe that could have caused it. Lowered my Lexapro to see if that helped. That didn't help. So I talked to all my doctors, and they were like, well, wait and see. The psychiatrist was willing to work with me to take my dosage down, see if that helped. It didn't. So I waited, and for like, I don't know, a day, a couple days, and I was like, nope, I'm going to Google and look up what needs to be done, because this is not fun. I had a newborn, and there were times, I think, especially since it was still new to me, like I tuned it in more, and I was like, I want to be able to hear all of the sounds that my baby makes. I want to be able to hear her coos, and like I feel like I can't hear things sometimes because I hear this extra sound that I'm not supposed to hear. it's blocking like other sounds. Now it's not so dramatic, thankfully. For me, it's not. I'm sure for other people it's louder. But that actually was kind of helpful in getting treatment. I found, luckily I have a PPO through my husband's work, his insurance, and so I scheduled an appointment with a local ENT. We live here in the San Diego area, so I scheduled an appointment at UCSD Medical Center. I went to UCSD, and I know it's an amazing school. Oh, my husband is in the Navy, so we have TRICARE, and TRICARE, excuse me, has been great. Excuse me. TRICARE has been great with all of this. It's been very nice to have that insurance. So I'm very lucky and very blessed. I know there are a lot of people who struggle with this and struggle with fighting with insurance and getting the treatment and the care that they need, which sucks because this is very real. And as I was saying, I went to the ENT and they tell me, oh, you have pulsatile tinnitus. Like, yeah, I know that. But they scheduled a hearing test. They wanted to know if it was affecting my hearing, And they did like a little thing with like a tuning fork and like had me listen with it in different spots and pressed on my neck to see if there was like a difference in the way that I heard it. I'm assuming to check like with the vascular flow if my hearing changed, like if it got louder or not, whatnot, to know that it was, from the vascular flow. Hey, here you go. Yeah, you're being so great. And so they scheduled a hearing test. I had the test done, and they found that there was a slight hearing loss in my left ear. It was just below like the average or the baseline. So it just, it was low enough that it counted as hearing loss. So there was like the normal baseline or whatever. My right ear was fine. My right ear was fine, and the left ear was below the baseline. So it was considered hearing loss. So I think that is what helped people take me seriously, because then the doctor, the UCSD ENT doctor, I hear you, the UCSD ENT doctor put in my chart that I had, hearing loss from this pulsatile tinnitus. So then they started scheduling my tests to find out, the cause. I let them know my whole story. This is when it started. This is how long I've had it. I think by the time I had my first test, she was 2 months old. I want to say it was end of November. So, I think she was probably a month old when I saw them for the first time, the ENT doctors. And so then they scheduled my hearing test, had that done, hearing loss, linked with pulsatile tinnitus. And so then they scheduled me for an MRA of the brain and an MRI of the inner ear canal. I believe it was with and without contrast. I'm not sure which one. But they were done simultaneously. And well, the without contrast part is done first, and then the with contrast. But the MRI of brain, MRI of the inner ear canal were done simultaneously. And because there were so many tests, I would need to look to see which ones said what. I also don't fully understand because it's like doctor lingo, but I think in that one was when it recommended, basically the impressions of it recommended further testing. They recommended the MRA of the neck, then maybe a CTA, CT angiogram, I believe. So that's what we did. We scheduled my doctor, went over the results with me and said, okay, we're going to schedule an MRA of the neck. At that point, I found the Whooshers Unite group on Facebook and read about a doctor, I believe in New York, who you can send him your test results, and he specializes in pulsatile tinnitus. And there were a certain types of tests that people recommended you have done, and sorry, I let my dog out. There were specific tests that people recommended you had done, and send those results to him, and he would assess, and people were finding answers through him who were not finding answers. So I looked up, she sped up. Poor mamas. Okay, let me get it cleaned up for a second. So silly girl. So I had the MRV scheduled. I called, or I wrote in to my ENT and said I would like to request that we have an MRA of the neck scheduled. I would like to schedule an MRV as well. Can you please put in an order for that? And she was great. They wrote me back and they were like, yep, the order is in. You can call and schedule that anytime. So I scheduled that. So that was those were the tests that people had recommended, was MRI, MRA, MRV, to send to this doctor in New York, I believe. But I was just, still going to go through UCSD and see, I was still going through them because they were still working with me and still very helpful. Amazing doctor, Dr. Kari there. Super kind. She's like, we're going to figure this out. I told her I was a mom and brand new mom. She was like, we are going to figure this out because obviously something is off. And I was like, awesome. Thank you. So I had the MRV done. I had the MRA of the neck done. And those recommended, basically the impressions were further testing. The MRV, I don't think anything was found. Nothing strange was found on that, but the MRA of the neck was the one where the impressions said they recommended the CTA or a DCA, Diagnostic Cerebral Angiogram, and neurointervention consultation, or neurointervention consultation. So my doctor called me and let me know, okay, so this is kind of what we're going to schedule a CTA, and this is kind of what a DCA, Diagnostic Cerebral Angiogram, is. You'll be working with this doctor, a neurosurgeon, Dr. Kolesi at UCSD is awesome. And you'll be working with him. He will do your angiogram, and that's just a little more, it's additional diagnostic test. It's not the same as a CT or MRI imaging. I'm getting ahead of myself. So, so I scheduled the CTA, scheduled the DCA. I had asked my doctor because I wasn't sure if I was still supposed to have the CTA. She said, yes, have them both. You can do either one, first or second, just whenever they can get you in for both of these. So they got me in for the CTA first, and the CTA said, looks like it's this. Bless you. God bless you. It looks like it's this. Have the DCA, and it should be definitively say if it is a fistulous communication. And I didn't really understand that in my results until after my DCA. Then I went back and reread all of the results from all of the tests. The doctors were great at explaining, like, okay, it could be this or this, based on what the tests had said, but I just didn't like quite understand. I was kind of just like, okay, well, let's keep doing tests until we figure out what it is. So yesterday I had my DCA and my Diagnostic Cerebral Angiogram. They go in through the femoral artery, and you have to fast for from the night before. So like I stop eating at midnight, don't have anything to drink, because they give you like a little, because of the medication they give you. I was fully awake for it. They went in through the femoral artery with a catheter, I believe, and go up through the arteries and put contrast in to take pictures. So it's kind of like, it is an imaging test, but it's a little bit more invasive than like an MRI or a CT. Those are non-invasive, obviously. And at the end, he was taking pictures, tells you, they have you hold your breath, don't swallow, don't breathe, don't move. And they take pictures, and then at the end, he said, there it is, you've got a fistula. And I'm thinking, what the heck is a fistula? Okay, cool. He said, I'll look at these pictures and figure out what the safest method is for treatment. So whether it be going in, I think again with a catheter, I'm not quite sure. I was like on the table. So we have a follow-up appointment where he'll talk more about it, but going in and putting in like coils or glue, I think, to like close it off. So basically there's communication, blood flowing, communicating between places it shouldn't be communicating. So they'll go in with coils or glue to close it off, or they'll open me up and do surgery to close off that communication. And then hopefully, perhaps I will not hear my heartbeat in my ear anymore. So my follow-up is in like 2 weeks. I hear you. Less than 2 weeks. I am excited that they found the source. A lot of people live with PT for years. Yeah, she's playing with the... I hear you. A lot of people live with it for years. A lot of people don't find their cause. A lot of people are still trying to get doctors to take them seriously. A lot of people still trying to get to the point where they even find the source. Some people are living with this and they have no idea what's caused it. They've gone through all these tests and then some, and the doctors are like, don't know. So there are different causes from what I've read and from what the doctors had told me, like, it could have been like a tumor, a benign tumor, the fistula, the communication between arteries or veins that shouldn't be there. Some people have these things or other causes, and the doctors don't recommend the surgery because it can be dangerous depending on the surgery, depending on what they need to do. And so if it's like livable, if you can live with it and just adapt to living with it, then they recommend doing that, because the surgery, they could require a brain surgery that's very dangerous, and where it's like the risks don't outweigh, if you can block it out, the risk doesn't outweigh the reward. So, and then I'm sure there are some people who are like, I don't care, like, I need to get, I cannot live with this. Because, like, mine, like I said, is very, very mild. Like, I can tune it out majority of the day. Most of the day I don't notice it. unless I'm talking about it or thinking about it. And then even then, like if I'm in the car, or if the TV is loud, I don't hear it. Especially like in the car, I don't hear it. I think because of the, the sound of the engine, I don't hear it at all. So mine is very, very mild. I have also learned to utilize the sound as a feedback. It's kind of a feedback loop for me. Being that I practice yoga and focus on like the breath and calming myself, different breathing techniques also that I learned in like therapy and stuff and for giving birth. It's a feedback loop for me. So if I hear that my heart rate is starting to increase, I hear my heartbeat get faster, then I just calm my breathing. I slow down. I take deep breaths. And I can hear it slow down. So at all of these doctor's appointments, when they take my pulse, like I can slow my breathing. And it starts to slow down. I could see where if you are constantly hearing this and it makes you so anxious, you don't have the tools to calm yourself down, that it would get faster because it's anxiety. It could be an anxiety inducing because it's something that you like know you cannot control. Because as much as I can control the pace, I can control the pace. I can't control the volume. I can't control the fact that it's there. The fact that for some people it may always be there. Sorry, my voice my voice is a little low because I had lost my voice a couple days ago and it's just coming back. So I use it as a self-regulation tool. I use it as a feedback loop, and I'm able to kind of enjoy that feedback. Being that I was a yoga teacher, or I'm a yoga teacher, I just haven't taught much since I had my little one. That's why I said it was. But being that I'm a yoga teacher, having that feedback is kind of helpful. Right? It's like the feedback of your breath. If you know that you're breathing really hard and you catch yourself breathing hard, then you can say, okay, slow down. I need to slow down for a minute. But I have that constantly in my ear all the time. Like if it gets fast, I know right away, okay, I need to slow down. So I've kind of learned to enjoy it. I've learned to use it as a tool. It's kind of like our voices, right? Like we talk and the world responds. We get feedback from the world. We talk to one another and you get a response, people respond. And so then you adjust, your voice accordingly or what you're saying accordingly. The same goes for my heartbeat. So it communicates to me. It communicates something to me. It tells me if I'm anxious or if I'm working hard, if I'm working too hard, or if I'm not working and not doing anything and my heart rate is really fast. So I'm like, why is your heart beating so fast? Like, take a breath. It's become my friend. Most of the time. There are definitely times when I hear you. Yeah, you're being so good. You want to do some tummy time? There are definitely times where I'm like, ugh, this is annoying. I'm over it. But a majority of the time, like I said, don't notice it, or I'm using it as a feedback tool, using it as a self-regulation tool. So the thought of not having it anymore kind of makes me sad. And I thought about posting this in the Wishers group, but then I would feel kind of messed up, right? Because I'm sure there are some people on there who would, and I don't blame them, part of the human experience, like, I'm sure if it was me and I knew I was going to be living with it forever and I did not like it, I didn't enjoy it, and someone went on there saying like, oh, I'm going to miss it. Like, depending on the day, I might be like, F you, like, you suck. What do you mean you're going to miss it? Like, why are you lucky enough to find a cause and get rid of yours? I still have it, but hopefully, I'm assuming, well, we'll see, it'll go away. But, some people might take that as like offensive. Like, you have this amazing opportunity to get rid of this thing that's not, typical, that we're not supposed to have, and that I don't want to have, and I'm stuck with, and you're saying that you're going to miss it. Like, take mine and I'll take your healing, so I don't want to, like, I kind of don't want to post there. I know that a lot of people would be like, I think some people would be understanding. Again, it's all part of the human experience, right? Like, emotions are emotions, like feelings, we can't control feelings. Like, I didn't imagine that I would feel like kind of sad that it's gonna be gone, that I'm not gonna have that anymore. Of course, I also feel very happy that, like, I'll be able to hear it. Like, right now it's really loud, I think, because I'm thinking about it. Like, I'll be able to hear everything all the time in the world and not have a distraction. That's exciting for sure. But I mean, I'm at home a lot of the time with my little baby, and so this thing is like, it's just a part of my life. Like, it's a part of my human experience now, and the fact that it's going to be gone and I won't have that feedback loop, that self-regulation tool, like, I'll have to tune in deeper to know, like, how my heart is doing. Like, am I anxious, or am I, overexcited? Do I need to take some breaths? Like, which is fine, right? It's not, I should be practicing tuning in probably more than I am, but it's nice to have that. Like, it's gotten to the point where most of the time, a lot of the time, not most of the time, it's nice to have that feedback. And so it's kind of like, oh, I'm not going to have that anymore. I'm going to have to learn other self-regulation tools, which is fine. Like I said, I know them, and, like, I teach yoga, so I know how to tune into the breath and to tune into the body. It shouldn't be hard. It's not going to be hard, but it's just going to be weird. And so that was why I made this very long video explaining, like, part of what I'm going through as a human being, part of the human experience, a small part of it. Wanted to share it with you because I'm sure there are some of you that maybe don't know what pulsatile tinnitus is, and maybe you learned something new. I didn't really teach much, I feel. I just kind of talked about my experience again. But maybe you had never heard of it and you didn't know it was a thing. You didn't know it was a form of tinnitus. It is different from the typical tinnitus. I do not hear a ringing in my ear. Once in a while, I'll hear a random ringing, but I think that's the same for everyone, right? Like, you hear a ringing for like 10 seconds, 15 seconds, it goes away. Happens like once every, I don't know, few weeks or so. Probably more common now with this than when I didn't have this. So I'm sure it's probably linked, but it's not typical tinnitus. Yes, you're doing a good job on your tummy. It is not the same as typical tinnitus. I feel like not enough doctors and not enough people in the medical world know or have heard of it. So just know, if you do have this or if you experience this, it doesn't necessarily have to be all the time like mine is now. It can be intermittent, like mine was when she was first born. I know there are some people in the group that I follow too that talk about how there's this intermittent, and then it can develop to be constant. But it is very real. There is a definitive cause. I know with tinnitus, people live with that for years because it's really, really hard. I haven't really looked into it as much, but it's much more, it's not as easy to find a cause. And even this is difficult to find a cause for a lot of people, but tinnitus is like even more of a subjective thing than pulsatile tinnitus. But pulsatile tinnitus is not so subjective. My husband could hear it. One time he went in to kiss me and he could hear, he's like, whoa, I can hear your heart beating. And I was like, oh yeah, you can? So can I, all the time. So I didn't know, but yeah, apparently he can hear that extra communication of blood flow. We practiced, we tested it out. I had him put his ear like right here, and he was like, yeah, I can hear that. And I was like, yep, that's it. That's, I guess I was like, but yep, that's what I hear all the time. Yeah. So it is very real. You are not alone if you do experience this. Talk to your doctor. Have a hearing test done. I think that is what helped. If you have PT and you have not had a hearing test done, have a hearing test done. I think that's what helped me get taken so seriously. Because, you know, that's what had them like, okay, we got to find the cause of this because, like, you can't hear. Like, this, you need to be able to hear. This ear is fine. This ear is diminished hearing capabilities. That's obviously related to that. So I think that's what helped them be like, okay, this is an objective thing. Like, I obviously didn't fake the hearing test. Don't fake your hearing test because they'll be able to tell that kind of thing. But, and it was only so slight, like the hearing loss was very, very slight, according to them. In fact, I saw another doctor that was not at UCSD, and they were like, this wouldn't even count. I wouldn't count this as hearing loss. And I'm like, well, thank goodness I saw another doctor because I wanted to get multiple opinions. I was like, thank goodness my other doctor did because maybe I might have gotten brushed off by this doctor. So have a hearing test done. If you can, get an order for MRA of the brain and of the neck. One of the neck was the one that I think recommended the CTA and the DCA. So an MRV, because it could be mine, I don't think is my veins. I think it's an artery thing, but it could be veins. CTA of the head and neck was what mine was. Head and neck. And then those thankfully led to recommendation of getting a diagnostic cerebral angiogram. And that was the one that was like, oh, there it is. I guess it was lighting up. Like, probably a nice big dark spot on there. I couldn't see it because I was laying flat. You can't move, but he saw it right away. There it is. You got a fistula. And then, you know, don't let anyone make you feel bad if you feel some sort of way about it. And if you do get treated, cutie pie, if you do get treated, it does go away. And you're like, wow, it's weird to say. I almost don't want to say it, you know, but I'm going to miss that. Like, it's part of the human experience, right? No one can tell you what to feel. And you shouldn't feel bad for feeling a certain way, right? Emotions come and go. It's how we react to them. So even though in my head, I'm like, oh, that makes me kind of sad to think about it. I also can choose my cognition, right? I can choose my thoughts and also turn to gratitude and thankfulness and be grateful that I was able to have access to the medical care that I had that they're able to find the root source, that it wasn't something more serious, because apparently this, that extra communication of blood could have manifested in other ways, an aneurysm or, other things. So thankfully it was not that. So I'm choosing gratitude, and then also allowing myself to feel, like I've lived with this for 4 months. It's been a part of my whole life, with my daughter. And so I'm going to allow myself to feel sad that I won't have this. Sounds silly to say out loud. But sometimes you have to say it out loud, right? To help you work through those emotions. Like, okay, I won't be so sad. But on days, when it is gone, and days that maybe I am sad, like, wow, this is really weird that I don't have this anymore. Allow myself to feel that. And then return to gratitude. So if you have any questions on my experience with pulsatile tinnitus, feel free to ask away. If you've made it this far, thank you for listening. If I've rambled, I apologize. If I've said anything to offend anyone, especially anyone with PT, I apologize. Your experience is valid, and your experience matters, and I'm praying for you, and if there's anything I can do to help, I'm probably, maybe you don't want to talk to me about it at all. That's fine too. I hear you, but I gotta go because the little one is like done with her tummy time. She says, Mom, pay attention to me. You've been doing so good. Yes, you're so strong. Thank you for listening. I wish you the best. God bless you. Thank you for being on this weird journey of life with me. I'm praying for you. God bless you.